Welcome to Kidney Talk, a program of Renal Support Network, a show that streams health, happiness, and hope to the kidney community. You can download all Kidney Talk shows from iTunes and find a variety of resources to help you navigate this illness at rsnhope.org. Please welcome your host, Lori Hartwell, who has lived with kidney disease since the age of 2.
Well, welcome to Kidney Talk. Today we're going to be speaking to Elizabeth Barnett. She is a partner and public policy expert for Avenue Solutions, and she represents Kidney Care Partners. And we're going to be learning about the CKD Improvement in Research and Treatment Act of 2021. So welcome to the show, Elizabeth.
Thank you for having me.
So tell us a little bit about S1971 and HR 465. And maybe you can explain why there's two bill numbers, because I don't know if people always understand that.
Oh, sure. I'm happy to be here to talk about this important bill. So, there's been a bill introduced in the Senate and also a bill introduced in the House. The Senate bill is S1971, and the House bill is HR 4065, as you indicated. And it was important to have both the House and the Senate introduce this legislation because the House will move the bill on a separate track than the Senate will, and presumably, at some point. The bill to become law, they'll have to reconcile differences between the House and the Senate. But it's always important when you're trying to advocate for public policy to try to advance the legislation in both chambers of Congress. So we're really fortunate that not only is our bill bicameral, it's also bipartisan. So meaning that a Democrat and a Republican have introduced the bill together. So in the Senate, for example, we have Senator Cardin of Maryland, along with Senator Blunt of Missouri. He's the Republican. They introduced the bill together. And then in the House, it's Congresswoman Sewell from Alabama, and then Representative Buchanan, who is the Republican. And we're just grateful that they've all teamed up to do this.
Well, that's really exciting to hear that people are playing together today.
Yes, it's kind of rare in Washington.
Well, tell us a little bit about the Medigap portion of the bill.
Oh, yeah, sure. Yeah, and the bill is really comprehensive, and it's just to quickly highlight it, it does have 4 different titles. The Medigap provision is in the patient choice of coverage title. And really what that tries to do is basically modernizes Medigap. Currently, the statute guarantees that Medicare beneficiaries over age 65 have access to Medigap plans because these plans are very helpful in helping patients plan and also defray the cost of Medicare services. People don't realize this necessarily before they enroll in Medicare, but there are some gaps in coverage, and Medigap definitely, helps to fill those holes in coverage. And so what the bill does is that, in current statute, it's only this Medigap policy is only available to those who are 65 and older. What the bill does is that it guarantees that anybody who has ESRD and is under age 65 will have also a guaranteed access to Medigap, because currently the younger contingent that's regulated by the states, and there are 19 states that currently don't require insurers to offer Medigap to these beneficiaries, and even in some of the states that do require it, the coverage is limited to maybe just one Medigap policy, or maybe they don't require coverage for ESRD patients, and some only limit coverage to Plan A, which doesn't even help dialysis patients. So what the bill tries to do is just equalize across the board, allowing any beneficiary who has ESRD to be allowed access to purchase Medigap in their state.
Well, and it's so important because in the state of California, we don't have Medigap. And what happens is, people qualify for Medicare and then they can't get a secondary insurance. And I've seen it over and over again. They spend down and go on the state program because that's the only way they can survive or to pay for that 20%. So it's so important that we have this this provision. So why don't you pick another provision and share about it?
Yeah, sure. So another, I think, really important patient provision is and this is new to the bill this year, it's really trying to get at preventative services and prevention in general. And this provision would expand the Medicare annual wellness benefit to include kidney disease screening. And, this tries to address the fact that often patients don't even realize that they have a kidney disease until their kidneys fail and they are admitted to the ER, and then they find out that they have ESRD. So what this would do, it would add CKD screening to the annual wellness benefit so that a Medicare beneficiary, once they're in the program, they can be screened for kidney disease right away. And so hopefully this would, not only make them aware of it, but it would enable them to get treatment earlier in the process.
Well, and this would be only available to people over 65, right? Because they would have to already have Medicare.
That's right.
What I find so perplexing is when you think you're going to the doctor, you think they're screening you for everything. I think that's maybe a misconception because you think, oh, I went to the doctor, and I just heard a story the other day of a patient calling me and saying that she's in stage 4 and she was never told she had kidney disease, and her doctor said, well, we didn't want to overwhelm you.
Oh, my gosh.
And that was a direct quote.
Wow.
When she was so upset that she didn't have the knowledge because she had some other health issues going on, but they thought that would just throw her under the bus. And so I think that people, I'm always a big proponent. People need to be an expert on reading their own labs. You can do this yourself. You can become an expert and question doctors on what things mean. Well, and one of the other things that I think is really important is that, Medicare beneficiaries need to know more about, there's an education benefit that's really good to let people know before they're on dialysis to be able to have access to education when they're in stage 5. And I think that's a really important measure.
Yes, there is a provision in the bill that would build upon the Medicare kidney disease education benefit, which is a current benefit, but unfortunately it's really underutilized. And so the section of the bill on this program would try to expand the benefit in a lot of different ways. It would allow dialysis facilities to provide these services, these kidney disease education services, and it would also expand the ability of other health professionals, just besides physicians, to actually, serve as a referral source for the benefit. So expanding it to PAs and nurse practitioners and clinical nurse specialists. And this is really important, too, in rural areas. And I think, as you said, also providing these services to beneficiaries that have stage 5 CKD who are not yet on dialysis. And this education really, as you said, tries to make the patient more aware of all their choices, and they can become better advocates for themselves and choose the treatment that's right for them and their situation.
Well, and there is a shortage of nephrologists. There seems to be there's a shortage, just for the record, there's a shortage of veterinarians too. Calling all people to become veterinarians and nephrologists. I have 4 dogs and it's hard to make an appointment. So it's the same thing with nephrologists. So they need to expand the benefit to have more people able to give a class. The next thing I wanted to talk a little bit about, and it just makes me so angry. I have to tell you, there's one thing that makes me really angry, and when patients can't know what they're getting into when they have to sign on the dotted line. And what I mean by that is, people are now that have kidney failure allowed to join in managed care. So you're on the little website and you're on dialysis and you have the option because there's a benefit of managed care. You don't have the 20%. It's basically privatizing Medicare, but we'll get into that. That's another story. But when you sign on to pick a company for managed care, they don't identify what dialysis facilities are around. So you could be in dialysis facility A and love the staff and love the doctor and then sign up for managed care, and you might have to go down the street or, who knows? I mean, how can you make a decision? This is just insane.
Yeah. So the bill does address this as well. We were really grateful that last year they agreed to put this provision in, which is new because the Congress didn't allow access traditionally to ESRD beneficiaries into Medicare Advantage until a few Congresses ago when they passed it into law, and that law just came into effect effective 2021. So beneficiaries today are now allowed to enroll in Medicare Advantage, which was a huge win for the kidney community. It's something that we had wanted, and this is really just to allow patients to choose and have a more variety of choices of coverage. And so, in addition to advocating for Medigap, we also advocated for Medicare Advantage. And so we're glad that the benefit is now available. However, as you said, when HHS was developing the regulations around Medicare Advantage, they removed dialysis facilities from the network adequacy requirements, and those standards are really important for patients because, as you mentioned, we want to make sure that patients actually have access to a facility that's close to them, that they don't have to drive for miles and miles, in bad weather or whatever, 3 times a week, and so we along with other patient organizations and also MedPAC, by the way, which MedPAC is an acronym in DC, but it really is good because it's an advisory committee that advises Congress on Medicare policy. And they even agreed that this was outrageous.
It's outrageous. And I had more renal care professionals at my wedding than my own family from my dialysis unit. So we need the continuity of care, which is so important. I want to just switch over real quickly because we got to wrap up about innovation. Can you talk a little bit about the bill and how it addresses innovation in the dialysis space?
Yeah, sure. So Title II of the bill is completely dedicated to trying to create a more economically stable dialysis infrastructure and also to incentivize innovation. As I'm sure everyone knows, the payment system for ESRD is really woefully underfunded, and we've continuously raised concerns about how the adjusters in the payment system are not appropriately targeted to really address the higher cost patients, and we're trying to restore accuracy of different payments to try to refine adjusters and et cetera. So in addition to that, the current payment system also has no real sustainable pathway to incentivize improvements in kidney care for patients. And so what we tried to do in the bill is to establish a pathway to innovation. And so what it would do, it would require HHS to adjust the payment rate whenever the current rate wouldn't cover the cost of adding a new drug or a new biologic or a new device or other technology that was innovative and approved for dialysis care. And they would be required to put that into the bundle, which is a fancy word for the payment that's paid to the dialysis facility. But this would be paid even after this transitional payment period ends. So currently there's a transitional payment period that does provide a little bit of boost in funding for innovation, but that's time limited. So what this bill would do is it would continue that and then allow the secretary to make adjustments to the overall bundle to account for those innovative products. And we really feel that this is such an important provision of the bill because there's all this innovation coming on the market, but because there's no ability to pay for it, sometimes it's harder for companies to invest in those.
It's impossible. I am so grateful for the Medicare program because I'm a product of it. But it has some flaws in how I've seen technology be developed over the course of my lifetime, and I can't help it, but I'm going to say the crit line, which is one of the best inventions ever made and for people on dialysis. And there was no pathway for reimbursement. So it has very limited use. And I find that very frustrating. And so, everybody listening, we need to really get this into law. Because if we want to see improvements in medication or medical devices, and Medicare has to pay a bundled payment system. It's a system that helps them control costs and know what they're going to spend, so it's not a fee for service. But we need to make this happen. If we're going to find any progress of the dialysis space in the future.
Yeah.
And I wanted to say that there's a lot of different provisions about quality, and I wrote a big blog piece on it that's on our website. You can go check out rsnhope.org/advocacy, and you can read about the bill, and there's a little button there that you can talk to your congressman, or better yet, call him up and tell him to support, or your senator, call him and tell him to support the bill. And it really takes a lot of people to move a bill. So we need everybody's help.
That's right. And your voices really do matter. When you call your congressperson and or you email them and you think, oh, well, that was a waste of time. It actually isn't, because they really listen to their constituents, and if they're any good, they do anyway.
Well,
but
and
they do take into account who they hear from back in their districts and their states. So your voice is really important. So don't think it's a waste of time.
Well, and I think the public needs to take a little bit more responsibility, because our congressman is our advocate. It's like they're your doctor.
Exactly.
And you got to treat them. Don't be afraid of them. We pay them.
Right.
Exactly. And so there's some kind of stigma, like, oh, no, they work for you. Bug them as much as you want. That's what more Americans need to do, is to be on the phone and talk to their elected officials what matters to them. So, well, thank you so much, Elizabeth, for sharing about the Chronic Kidney Disease Improvement and Research and Treatment Act of 2021. And we look forward to getting this bill passed.
It was my pleasure. Thanks so much.
Thanks for listening to Kidney Talk, a program of Renal Support Network. Please make sure to find us on Facebook or sign up for our newsletter at rsnhope.org. Kidney Talk is intended for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your physician. Always seek the advice of your own healthcare provider regarding your medical condition.